everyone. My name is Christina Rosen. I am the Vice President of AHIMA International, and I am delighted to be here today with Dr. Alhawsawi, who is one of the globally most well-known people when it comes to patient safety. And we're talking to Dr. Alhawsawi today because we're celebrating Patient Safety Week, Patient Safety Awareness Week. And in fact, this year, there's also been an addition to that because we're calling it Patient Safety and also Healthcare Workers Safety Week. And on that note, I'll let Dr. Alhawsawi introduce himself and maybe also talk a little bit about why healthcare worker safety has been added as a very important component for this week of where we focus on patient safety in particular.
Thank you very much, Christina. Hi, everyone. My name is Abdulelah Alhawsawi. I'm a transplant and hepatobiliary surgeon, both American and Canadian board certified. I call myself a patient safety advocate. You know, I'm passionate about this area. Over the past 10 years, I've been working at different capacities to trying to promote patient safety in the kingdom, within the region, and globally. I was with our national healthcare accreditation organization called SEBAHI. And in 2016, I was recruited by the Ministry of Health to help establish the Saudi Patient Safety Center. And from the time of its establishment until 2020, we're very proud to take it to become one of the WHO's collaborating centers for patient safety policies and strategies, one of only 5 globally. We also, during last year, during the Saudi presidency in the G20, we put patient safety on the G20 agenda for the first time, and we're glad to see it also continue with the Italian presidency. But I'm also engaged with the WHO work on patient safety. At different levels, and now with the World Health Assembly's resolution that got passed in 2019, I'm also part of the task force working on the implementation plan. But, and of course, lately I became an advisor to AHIMA International because the health information management piece is at the core of the safety in healthcare, period. So, we're all aware of the elephant in the room, COVID, and COVID unfortunately claimed more than 2.6 million lives since it was, yesterday actually was the anniversary of COVID. So it claimed 2.6 million lives, and caused a lot of problems globally, as everyone is aware. And so last year was during the World Patient Safety Day, which happens on September 17th. It is the theme for that day was health worker safety is a priority for patient safety, which is something that I think very strategic, very true, that for decades we viewed these two safeties are as separate. And I think we need to kind of reevaluate how we view safety in healthcare and look at it as not a zero-sum game, but actually two complementary safeties. So I like to view them as two sides of the same coin. We can't have patient safety without the staff safety and vice versa. So that's the whole concept of co-production. And this year is also the International Year of Health Workers, and giving all their sacrifice and contribution to deal and with patients and reduce their sufferings in spite of the risks that they take on a daily basis. So yeah, I mean, this is where we were, through this Patient Safety Awareness Week, we're very also glad to have the release of this report, which we're going to talk about.
Yeah, thank you so much for that. And I completely agree with you. I mean, patient safety, health worker safety, it really goes hand in hand, as you explained so well. And yeah, so you mentioned the reports, and could you tell us a little bit more about this report that I'm hearing so much about? I know that you have some very high-level people that have been contributing to the report and will also be presenting it this week. Excited to hear a little more about that.
Yeah, so after I left the Saudi Patient Safety Center, I became a global ambassador to a great organization called the G20 Health and Development Partnership. And through our work within the partnership, the idea of the report came about, and we literally called it the overlooked pandemic, because as we know, in a year, COVID claimed 2.6 million lives. One of the reasons that we put patient safety on the G20 agenda is the human cost. So only in low middle income countries alone, so this is just low middle income countries, 2.6 million people actually lose their lives from medical errors and preventable harm. 134 million people in low middle income countries are harmed and face adverse events, but out of those 2.6 million lose their lives. But it is estimated that around 5 million people lose their lives globally from medical errors. In 2016, there was a study from the BMJ that talked about 251,000 Americans losing their lives in the US. And that study showed that unsafe care is the third leading cause of death, to be preceded only by cardiac heart disease as number 1 and cancer as number 2. And in Canada, in 2018, there was also a study that showed that unsafe care is also the third leading cause of death, causing around 28,000 people to die from it, out of 36 million Canadians, give or take. I mentioned the examples of low middle income countries as well as the high income countries like the United States and Canada to show that unsafe care and the issues of patient safety and health workers safety are not based on specific geography. They're not they're not kind of a high income or low income. It's actually a healthcare system issue. And unless we address those head on, we won't be able to deal with this overlooked pandemic. I mean, I also sit on the board of the Global Sepsis Alliance, and every year, and just take this number and just keep an eye on it. 11 million people lose their lives from sepsis. Sepsis is basically it's a condition that happens when an infection that happens anywhere in the body overwhelms the body's defenses. So what the body tries to do is to try to kind of overcompensate, and in that overcompensate or overreaction, it actually results in damaging its own tissues. So it's like a collateral. The body becomes a collateral damage, and 11 million people lose their lives from sepsis, and so many more millions also even not losing their lives. They suffer from the sequelae of sepsis for months and maybe years to follow. Things like antimicrobial resistance claim the lives of 700,000 every year, but it is estimated, it is projected that by 2050, if we don't do anything with antimicrobial resistance, we're going to lose 10 million people every year. So these are astronomical numbers. And yes, COVID is a problem, it's a pandemic, we have to deal with it, but it claimed 2.6 million lives. And when we look at all these millions of lives that we're not hearing about in the news, if this condition is being talked about, there not a day goes by without having all kinds of news in all languages talking about COVID. But it only claimed 2.6 million lives. I'm talking about sepsis claiming 11 million lives. I'm talking about, medical errors claiming up to 5 million lives, AMR. So that's why the whole idea we called it the overlooked pandemic, because it is a pandemic, if you look at the definition of pandemic, it's something that cuts across different geographies, and this cuts across different geographies. So this is the whole kind of idea behind calling it the overlooked pandemic. And we wanted to make sure that there are a number of esteemed authors from different backgrounds that, would contribute to this publication. So, there are politicians, there are scientists, there are people from different backgrounds. The forward of the publication is done by His Royal Highness Prince Khalid bin Bandar Al Saud, who's the Saudi ambassador to the UK. But the contributors list include someone who's very well known to us, Dr. Tedros, the WHO's the Director General. We also have the Chief Medical Officer of Italy. We have Mr. Jeremy Hunt, who's one of the global, champions and leaders of patient safety through his time when he was a Minister of Health in the UK, and continued to be a champion and contributor to patient safety, even as a Minister of Foreign Affairs, and even afterwards now as part of the Parliament, and many other contributors. Mr. Alan Donnelly, who's the convener and the leader of the G20 Health and Development Partnership, and others. That I can't remember now, but the publication will come up, and I really ask and encourage everyone to read it, and hopefully this is not just kind of made to be kind of a fun read, but also it is an action-oriented, and it has certain, recommendations that hopefully will see the light of the day, that will put a dent on this overlooked pandemic.
Wow, I mean, those are some really astounding numbers that you mentioned. Being Danish myself, I mean, we're 5.5 million people in Denmark. So while you were talking, I was thinking to myself, that's the equivalent of wiping out Denmark on an annual basis. I completely understand this term you say, like the overlooked pandemic. So I'm just very thrilled that we now have this Patient Safety Awareness Week, also Healthcare Safety Awareness Week, where we really try and highlight this pandemic, really. So hopefully we can do something about it. I'm also thrilled to hear about that high level of support that you're getting for the reports. I think, again, that also shows that it's really something that's on the top of the agenda now, of some really important institutions and individuals working in this space. I was intrigued what we were saying about sort of the health systems and how they have to get on board. And this week we're using the hashtag #ZeroHarm. And I wanted to ask you, where do you see really sort of the global barriers being for achieving zero harm? both for patients and healthcare workers?
Yeah, that's a great question. So let me start answering this question by mentioning a quote that is kind of near and dear to my heart, which is by a philosopher, Aristotle, and he said, a long time ago, our problem is not that we aim too high and miss, but our problem is that we aim too low and hit. So for decades, we had the healthcare being resigned to the fact that, there's nothing we can do. 10% of patients will be harmed through healthcare. And, when I have that conversation with some of the, hospital leaders, here's what I do. I was like, okay, tell me please, how many patients that you see a day? And I had this hospital that they saw 1,000 patients a day. And I was like, okay, so please tell me the names and the medical record numbers and the information of the 100 patients you're gonna harm today. So I took it from this kind of, high level scientific way of like, 10%. And I was like, okay, so now you're telling me that you have 1,000 patients you're going to harm today. You're planning to harm 100 patients because you're just saying that, we're throwing up our hands and saying that there's nothing that can be done.
Yeah.
And I know, and I've yet to see any patient that would be okay with being harmed, any family member that would be okay with being harmed, or any, clinician that is waking up in the morning going to work as like, yeah, I'm going to harm me 10% of the patients I'm going to see today. So in a way, I think, it's our problem is in the imagination that we we can do better. And just imagine what would happen globally if the aviation industry had the same attitude. Maybe 1% of airplanes would crash. And I'm going to digress to the aviation industry, but I'll come back. But I always talk about this incident of the 737 MAX, that is known to everyone. So it's the Ethiopian Airlines that crashed. And 8 months before that, there was another airliner in Indonesia that crashed with the same airplane. So it took only 2 airplanes 8 months apart to crash for the very swift and strong reaction of the aviation industry, which is to ground all 737 MAX 8 airplanes globally. There was no airplane from that kind flying. Now I had this conversation with Mr. Jeremy Hunt, and I'm sure he would be okay with me, talking about it, because he actually mentioned it in the 4th Global Ministerial Summit, which was in Jeddah, that he said during his time as a Minister of Health, there was around 150 people dying in the UK from preventable harm every week. And I was like, this is the equivalent. So what I told him afterwards, in discussion, that this is the equivalent of a 1 airplane crashing every week. So we have 52 weeks a year. So I said, how many crashes would the British people or any people globally would put up with before something has to be done. So this is an advanced healthcare system that was losing the equivalent of an airplane crashing every week. And I just gave you the example of the aviation industry as a high reliability and the safest probably industry in the planet, thank God, where their goal is zero harm. And their goal is not just zero harm. Their goal is like to keep pushing the envelope towards, whatever ounces of safety that they could reach. So zero harm, to come back to your question, zero harm, I think should be the true north. So I'm very glad that, this hashtag is coming up, and hopefully that we want to see this hashtag continues throughout the year, because zero harm is a mindset that, every patient that we see in the hospital, in the clinic, in the primary care deserves to be free of harm. And every, health worker deserves to be free of harm, and every facility deserves to be free of harm. So it's like a true north where the whole healthcare system, starting from the WHO all the way down to governments and ministries of health, down to boards, down to the bedside, thinking that every day, 365 days a year, we should not accept any patients being harmed. So if that mindset is there, then we would start thinking, in a different way. I'll use another quote of someone who's also known to everyone. So Einstein says, our problem, we can't solve today's problems by the same level of thinking that created them. So in a way, we are where we are today in healthcare because of whatever thinking that we have. And I think we have to kind of think about this problem from a different angle, but we have also to raise the expectations. And I think if we just put zero harm as a true north, then we will find ways to reach zero harm. It's that my problem with this concept that many people talk about, and I urge you to read the chapter by Mr. Jeremy Hunt, because he talked about how he was told when he came in as a Minister of Health, being not a clinician, that this 10% thing that 1 in 10 people will be harmed, and he just said that it's unacceptable. So if we think about harm as unacceptable, then we can think about ways of reducing that harm, and we could break it down into smaller pieces. And I wrote the chapter of zero harm in the publication, and I talked about how to eat an elephant and one bite at a time. So it's like, let's break down this big giant goal of zero harm for everyone on the planet into smaller pieces. So I just want the nurses, the clinicians who are dealing with the patient who's just being admitted to think, okay, on my shift, not on my watch, this patient is going to be harmed. And then we even pull the patient and the family in. So we break down, so we can have, and we can celebrate these successes. So we have a shift. How many shifts do we have in a day in a hospital with no harm? Let's celebrate those successes. Let's engage the patients and families and try to work, have this shared responsibility. So this is the responsibility of the patients and families, not to be harmed. That this is our responsibility. It can be done in an 8-hour shift. It's not like Mission Impossible. So, and then we can take it to the next shift and to the next shift, and this is how you eat that big elephant.
Yeah, I was thinking to myself, wow, eating an elephant, that's quite a project. But thank you for putting it in those terms, because I think also this correlation with the aviation makes it very real for anyone really, especially those that have been on an airplane, which is a lot of the people in the world. And I think also one of the things you mentioned that was important before is that this is not something that's specific to a region, really. I mean, it's something that's happening around the globe, and in some of the most advanced healthcare systems worldwide. So I certainly hope that this can be the kickoff for not just zero harm to be a hashtag throughout the year, but for many years to come, and potentially beyond that as well, because I think it's something we just need to start embedding in every conferences that we're doing, every procedures that are being considered. And we are in this moment now of healthcare transformation. So it's an amazing time really to start taking some big bites of the elephants. And on that note, so at AHIMA, of course, we believe that healthcare information is really the key to transformation. And I wanted to ask you here towards the end, where do you see the connection there between healthcare information and patient and healthcare workers' safety?
Absolutely. So the WHO views health information management as one of the pillars of any healthcare systems, and I view the information as like the blood of a healthcare system. Starting from the macro level all the way down to the micro level at the bedside, and a big preventive and protective strategy to promote safety and reduce harm is to have data-driven decision making, and is to have meaningful use of data for all stakeholders. So I'm a believer that with the concept of co-production, where the information should be used by both from the provider side as well as the patients and family side. But I don't look at it just at the episode of care. I look at it throughout the individual's life. So it's empowering individuals that from every now and then they need to be encountering, the healthcare system through an episode of care. But if we use the health data to empower individuals to become the healthiest version of themselves outside the healthcare, outside the hospital, but also to come into the healthcare system empowered with the right amount of information at the right time, in the right place, in the right format, I believe we will transform healthcare systems, not just from a safety, which is the basic minimum that everyone deserves, but I truly believe that we will transform the healthcare industry to make it more efficient, to reduce the cost, to reduce the waste, and to really put it on a trajectory to be sustainable. So AHIMA, giving its leadership in this space, I think is very well positioned to kind of lead the charge towards that future that we're hoping for. And now with COVID, everyone is talking about healthcare systems resilience. I'm sure that we will not have healthcare systems resilience if we don't address the health information management situation. This fragmentation of data, the difficulties of using the data, the lack of fluidity of data is unsustainable. And I think we cannot continue with the same trajectory. Clinicians and physicians are complaining about electronic health records, and not being able to actually get whatever information that they need in a user-friendly way. You know, patients are complaining about physicians turning their backs on them and typing on keyboards. So the two important stakeholders in a healthcare system is clinicians and patients are not satisfied with this very important tool of the health information management, which is electronic health records. And we cannot just continue with trying just to make small fixes here and there. I think we have to kind of pull back and try to figure out why, what is it that we want, so what's the goal, and then how can we, we need to get some systems engineers to look at how we can re-engineer, the whole health information management. As I mentioned, I'm a true believer that transforming this field will not only transform safety, which is the basic minimum that we require from healthcare systems, but it will transform healthcare systems, period.
Yeah. Yeah, well, as some people say, it takes a village. But certainly health information, better quality information and so on will definitely be a key to that transformation. So I think we're coming to the end. I just wanted to ask you one last thing. So, of course, there's a lot of, we've been talking a lot about patient safety, healthcare worker safety. So to quote, you've been quoting a lot of people. So if I quote another well-known person, Elvis Presley, he said, a little less talk and more action, something along those lines. And I think that's where we are a little bit now. We can see all this harm is happening. The numbers are just tremendous. Now, what do we do specifically in terms of action? And I know that you've highlighted some things today. Those are also very big things. So if there was one thing perhaps that you could say, let's make this a goal to be implemented in 2021 to reduce harm, what would that be?
I would say to help establish the global fund for patient safety and health worker safety. And again, this is not because I'm biased with the idea of trying to get that safety fund done. So when you look at the healthcare systems and you look at the global health, there has been a number of funds globally that did a lot of great efforts, starting with the big ones like the Gates Foundation. There's also the Global Fund that worked on TB, HIV, malaria, also UnitAid that worked on TB, HIV, malaria. And the numbers speak very loud of what these funds have done in transforming, these very challenging diseases in low-income countries. Now, we don't have anything equivalent to those funds to promote safety. And I think that's why, we don't have many people know about these big numbers, people dying in the millions, way more than COVID. And death is the tip of the iceberg, because you have major harms, you have minor harms, you have also the psychological harm. So we're just talking about the tip of the iceberg, which is millions of people losing their lives. So death is the ultimate harm, but then there's all kinds of different harms that we're not even talking about today, and they're in and kind of way bigger kind of multitudes of what we mentioned about the death. Having an international mechanism working on bridging the implementation gap. So over the past decades, we have bridged the knowledge gap in the area of safety in healthcare. So we know what to do. The problem is, why is it when we know what to do, we're still not doing it, and we're still kind of propagating this big challenge? I think the reason is we don't have the global champion, the global mechanism to work on bridging the implementation gap. So having this fund, which is going to be zero, kind of laser focused on this safety of patients, safety of health workers, creating X prizes on an annual basis with crowdsourcing innovative ideas about how to come up with some innovative solutions for them, engaging the entire stakeholders, not just ministries of health, not just academia, not just the the private sector, but everyone on the planet is and should be interested about the safety in health work in healthcare. So again, if I have a magic wand, or if I have one wish, is to for us to work together to establish this very important entity, establish this global fund to promote patient safety and health workers safety, and I'm sure that it's just a matter of time before this happens, but hopefully we want to see it in 2021.
Excellent. Well, thank you so much. And just wanted to say that if someone's out there and interested in knowing more about the fund, we will add the contact information, to Dr. Alhawsawi or anyone else who's involved in this and can help to provide more information about the foundation. So thank you so much for your time today, Dr. Alhawsawi, and I certainly hope that we'll be meeting again next year on this topic, and you'll be reporting, or we will be reporting, much, much lower numbers than the ones that you have come with here today. So thank you again for all your efforts, dedication, and passion towards reducing harm on a global scale. And looking forward to hearing more about what's happening with the foundation as well.
Thank you. Thank you very much.